Greetings to our lecturer, Madam Christina Busak. We are from Group 2E. We will be presenting on our reflection for week 1 in Maternity 3 ward. Our clinical instructors for week 1 were Madam Caroline and Madam Gillette. So our group is consisting of 5 group members, which is me, myself, Hamizi, Siti Jumaitun, Wong Chai-ying, Athanasius Sulang, and Jesserina. This is our outline of the presentation, which are consisting of procedures that we have done in the ward throughout this week and strengths and weaknesses of doing the procedures. So we will proceed with my friend.
The first procedure we have done in Maternity 3 is care for the umbilical cord or cord toilet. The strengths for us while doing the procedure are able to perform newborn cord care correctly, can improve the skills and be competent in the care of the umbilical cord, able to perform assessments of the umbilical cord especially on the signs indicating problems of umbilical cord, redness, swollen, foul odor, wart, jelly, etc., and can handle the baby in a safe way as an opening their wrapping in diapers without injuring them. For the weakness, we lack of disposable gloves while doing cord toilet, lack of dry swab which causes us to have separate one swab into half, and this process was time consuming. No documentation for us to document the abnormalities of the cord, takes more time to wrap the baby after doing cord toilet, which caused longer time to finish doing cord toilet in the ward.
Okay, for the second procedure is removal of indwelling urinary catheter and vulva swabbing for postnatal mother. So we were able to differentiate the types of lochia and detect any abnormalities such as abnormal color, amount, and smell of the lochia. However, we have limited equipment like postnatal stat care and lotion chlorhexidine 1 to 2000. Aqueous. We use sterile water instead of chlorhexidine because most of the chlorhexidine lotion have expired. And then the second one, the male nursing students were proactive in performing vulva swabbing, although it involved female private parts. However, there are some patients reject them for a few times. And then the third one, we were able to build rapport and good communication with the mother. However, we have lack of time spent with the mother as we are only able to communicate with them for 2 days in the ward. The fourth one is we were able to perform vulva swabbing and opening the sterile packs correctly. However, we does not clearly remember the sequences of the procedures, such as palpate the uterus to remove blood before donning sterile gloves. The next one, there were enough vulva swabbing for each of us, and we were able to perform more than once of vulva swabbing as there were many mothers to be swabbed. Hence, we are able to improve ourselves better than yesterday. However, it takes a lot of time for each mother to be done because we were lacking in confidence and experiences on the first day. Next one, we were able to build rapport with the post-basic students and divide the tasks. Hence, we only focus on vulva swabbing first before going to help them baby bathing and cord toilet. However, we were too dependent on post-basic students. We were lacking in contact on the management for care of babies such as baby bathing, care of NNJ babies, and examination of newborns. And the last one, we were able to build rapport with the staff nurses and booked all the mothers requiring vulva swabbing. However, we consumed too much time as we need the supervision from CI for each of the mother and delaying other procedures that could be done to the mother. Also, we forgot to palpate the abdomen of the postnatal mother and noted the involution of her uterus.
Now, I am going to present procedure of supervised breastfeeding for postnatal mother. The strength when we do this procedure are we able to teach the correct position of breastfeeding to the mother, such as cradle position, cross cradle position, and side lying position. And then we able to recognize the normal and abnormal appearance of the breast of the mother. And the strength is can provide brief health educations about the benefit of breastfeeding to the mother. For the weakness, when we do this procedure, that is, the male nursing student encounter problem in supervising the mother to breastfeed because unable to get the mother consents. Apart from that, unconducive environment is unable to provide a higher quality health educations for the mother in a more private place. Lastly, unsure if the mother fully understood due to being occupied in taking care of the baby.
Okay, now I will talk about the fourth procedure that we have done in the ward, which is assist in vaginal examination. For this procedure, only me, Jesserina, and Wong have assist in this vaginal examination. As for the strength, we were able to observe how the doctor performed VE, and we have also learned the purpose of doing VE for the mothers, which is to check for the healing of vagina, perineum, cervix, and pelvic floor tonus. And we also learned that VE has two types, which are digital and speculum. And we were also able to communicate with the mother and help them to change their soiled sarong after doing the procedure. For the weakness, firstly, the doctor did not inform anything about the results of the VE, so we did not know anything about it. Second, we does not know the terms that the doctor used to describe the results of the VE. We only know the findings reported by the doctor, which is no hemorrhage at the vaginal and perineal area. And we have only observed how the doctor performed digitally and not using the speculum. Lastly, we did not inform the mothers to report to the healthcare staff if there was any excessive bleeding after VE. Thank you.